for questioning. Dr. Blumenthal, you talked about the meaningful use requirements as this was defined, obviously, in the stimulus. And, well, it isn't defined, actually. That's what we're looking at, defining it. And you state in your testimony that you expect to publish a rule by late 2009. And this is we're midway through June now. How is your office approach defining this issue? Can you explain how you're going about this, and what steps will you take if you're unable to meet that deadline? I mean, do you think you're going to make that deadline by the end of this year?
Madam Chairwoman, the regulation will actually be a CMS regulation, because CMS is tasked with providing the bonuses to physicians and hospitals under the law. So CMS will actually run the regulatory rulemaking process. Their plan right now is to have that regulation ready to put in the form of a notice of proposed rulemaking by the end of this calendar year. And we will be advising them on that definition and helping them come to a conclusion about it. We have a continuing process that we have outlined. We're going to hold another hearing of our Health Information Technology Policy Committee on July 16th. That group heard from a working group on a definition of meaningful use on June 16th. We are still in the process of a public comment period on that definition, which I want to make clear was a definition proposed by a working group of an advisory committee, not by the department. And that advisory committee, after the July 16th hearing, we hope will make some recommendations to the national coordinator. There will then again be a period of open comment on that definition, and then the process of rulemaking will begin formally, and we hope that that notice of proposed rulemaking will be available by the end of the calendar year.
Who's involved in the working group? Like, can you give me some examples?
The working group was actually created by the stimulus bill, by the Recovery Act. Its membership was very explicitly defined. GAO appointed the large bulk of the members. Members of this body and of the Senate appointed additional members, and the Secretary appointed 3 members. So it represents a broad group of stakeholders, hospitals, physicians, insurance companies, consumers. So it's a very broad and a very clearly defined membership in the law.
Okay. Since the certification process is, can be slow, some providers will be unable to adopt certified EHR systems when the incentives for the Recovery Act become effective. So what steps is HHS taking to encourage the Commission on Health Information Technology to develop and implement standards more quickly?
So we are comprehensively reviewing the certification process. We were asked to do that under the law. We will be making recommendations concerning what the certification process should be. The Certification Commission for Health Information Technology has been tasked with doing that certification in the past. We will be looking at its role going forward. We certainly hope that that process will be capable of certifying very many, certainly more than sufficient number of records, so that physicians will and hospitals will have ample time to adopt certified records. That's certainly the goal of our office, and we hope to be able to design a process that allows innovation, the certification of new and innovative products, as well as the certification of products that already exist on the market.
The Recovery Act did not extend HIT funding to a large number of health professionals who operate in the Medicare and Medicaid program. However, many expect HHS to compel these providers to adopt HIT if they're going to continue offering Medicare and Medicaid services. If HHS takes the step, should there be some relief or financial incentives for these providers as well?
I hear in your question an assumption that at some point we may compel the adoption of health information technology. And I want to make clear that that's not contained in the Recovery Act right now. And so I think it's somewhat speculative to talk about what would happen if that were to happen in the future. That is not a plan on the books right now in the department.
You're not looking at compelling
No.
others to do this at this
No.
point? Okay. My 5 minutes is up. I'm going to now recognize the ranking member, Mr. Westmoreland.